Trolamine salicylate is an ingredient in Arthricream Rub Cream and is used to relieve minor muscle and joint pain, such as arthritis, backache, and sprains. It belongs to a class of drugs called salicylates. This cream can be applied to the affected area several times a day, as needed for pain relief. It is best to apply the cream when you are experiencing discomfort. It's important to follow the directions on the product package. If you have any questions, it's best to ask your doctor or pharmacist for guidance. This cream is meant to be used only on the skin, so be careful to avoid getting it in your eyes, nose, mouth, or vagina. If you accidentally get the cream in those areas, make sure to flush with plenty of water. You can apply the cream to the affected area no more than 3 to 4 times a day, rubbing it in gently and thoroughly. After applying the cream, remember to wash your hands unless you are using it to treat your hands specifically. Avoid applying the cream on broken or irritated skin, and don't bandage or tightly wrap the affected area, or apply heat to it, as doing so may increase the risk of side effects. For more details, you can always ask your pharmacist. It's important to let your doctor know if your condition lasts for more than 7 days, if it gets worse, or if it keeps coming back. And of course, if you suspect a serious medical problem, seek medical help right away. If your doctor has prescribed Arthricream Rub Cream, it means they believe the benefits outweigh the potential risks. Most people who use this cream do not experience serious side effects. However, if you notice blistering, peeling, redness, or irritation at the application site, or if you experience nausea, vomiting, or ringing in the ears, stop using the cream and contact your doctor immediately. While very rare, a serious allergic reaction to this cream could occur. Seek medical help right away if you notice symptoms such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not an exhaustive list of potential side effects. If you experience any other effects not mentioned here, be sure to reach out to your doctor or pharmacist. Remember, always consult a healthcare professional for medical advice about side effects. Before using Arthricream Rub Cream, it's important to talk to your doctor or pharmacist if you have any allergies to trolamine salicylate, aspirin, or other salicylates, or if you have any other allergies. This product may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. You should also inform your doctor or pharmacist about any medical history you may have, especially if you have asthma or nasal polyps. If you are planning to have surgery, make sure to tell your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Since this drug is similar to aspirin, it should not be used by children and teenagers younger than 18 years if they have chickenpox, flu, or any undiagnosed illness, or if they have recently received a vaccine. In these cases, this drug may increase the risk of Reye syndrome, a rare but serious illness. If you are pregnant or planning to become pregnant, it's important to discuss this medication with your doctor. This medication may harm an unborn baby and cause problems with normal labor and delivery. It is not recommended for use in pregnancy from 20 weeks until delivery. If your doctor decides that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. You should not use this medication after 30 weeks of pregnancy. Be sure to discuss the risks and benefits with your doctor. If you are breastfeeding, it is unknown if this product passes into breast milk, so it's important to consult your doctor before breastfeeding. When using Arthricream Rub Cream, it's important to be aware of potential drug interactions that could affect the way your medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without first obtaining approval from your doctor. This will help ensure your safety and the effectiveness of your treatment. If this medication is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., residents can reach their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Remember, always keep this medication out of reach of children. Be sure to keep all of your scheduled medical appointments and lab tests while using this medication. If you forget to use the cream at the scheduled time, you can apply it as soon as you remember. However, if it's close to the time for your next dose, it's better to just wait and use the cream at the regular time. Avoid using a double dose to make up for the missed one. It's important to store Arthricream Rub Cream at room temperature away from heat and to keep it out of reach of children and pets. When it's expired or no longer needed, be sure to properly discard it by consulting your pharmacist or local waste disposal company. Avoid flushing it down the toilet or pouring it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.